Over the years, young Nigerians crippled by polio have found themselves dealing with the negligence of their parents. The common practice in Maiduguri, like most northern states, is for polio survivors who are usually from poor homes to hit the streets every other day begging for alms. Faced with the sad reality of a bleak future, the polio survivors now engage in peer education and advocacy promoting immunization.
It started like fever when I was 2 years old and there was no cure. The hospital said I had polio. People should get vaccinated. It will help eradicate polio. We have learned some trades and handcrafts, and we appreciate if the government would provide us with workshops. We don't feel happy begging on the streets.
Community leaders have also been actively engaged in the campaign for their subjects to embrace polio immunization. They understand the danger of not immunizing kids, and now all suspicion and ill will towards the vaccine has diminished.
Our
people were worried before now that if common malaria is not treated free in hospitals, why would polio vaccination be free? They found it suspicious, but when we understood that there is a cure for malaria, unlike polio, we encouraged them to embrace polio vaccination.
The executive director of the State Primary Healthcare Development Agency says the conversion of internally displaced persons in the state capital has offered an opportunity for health workers to reach out to more kids.
The last case of polio we had in Borno is in December 2013. And that case we found is in one of those security challenge LGS that we cannot access to do immunization. But since after that, we have not had a case of polio. So in Borno State, even though we are not able to reach all the LGS because of the security challenges, we take every window of opportunity to immunize children wherever they are, either in the IDP camps, in the host community, and all those places.
The Rotary Club has been on the forefront of the anti-polio campaign. Officials are proud of Borno State's achievements.
We are hoping that 2016 we can put a final transmission everywhere in the world, even in the other two countries that are remaining of Pakistan and Afghanistan. And when we are through with polio eradication, we can face other health challenges that we have in this part of the world in particular.
The periodic house-to-house vaccination which kicked off last Saturday, but the vaccination and campaign has by no means ended, with the children themselves cooperative and excited to be polio-free.